Further remarks, the good member from the 19th District, Representative McEntire.
Thank you, Madam Speaker, giving me the opportunity to speak to this bill. I don't quite know how to thank you for allowing us to be here today. There's a saying from one of Shakespeare's great works, "My kingdom for a horse," which in common parlance means making a trade-off that ends poorly. That you would trade a kingdom as a sovereign for a horse. We have the best intentions, especially members of this chamber. Our intentions are impeccable, and everyone is trying to do the very best. Unfortunately, good intentions have hurt the healthcare industry. Specific examples of late with the COVID pandemic. I don't want this to be another good intention, which we have, which leads to bad results. That while we're trying to do something good for those in the healthcare industry, we're making it harder for healthcare industries in Washington State in general to do what they do, and that is take care of people. It was said by a good member earlier that hospitals are different in their various communities, and they need different things. Having an overarching blanket policy like this, trying to fix a problem as noble as our intentions are, is actually not going to have the desired effect, I'm afraid. And for that, because I am a results-driven person, I'm going to have to say no to this. And I'd urge you, Madam Speaker, to join me. Vote no. Thank you.
Further remarks, the member from the 19th District, Representative Walsh.
Good afternoon, Madam Speaker, and members may be given some grace for confusing mornings with afternoons. We've been through a lot the last few days. Maybe next session we will run a bill addressing legislative staffing needs and overtime issues. It'll keep us straighter on where.
Would the member please speak to this bill? Please proceed.
Thank you, Madam Speaker. It's a bad bill. Vote no. The fatal conceit, Madam Speaker, the fatal conceit. The idea that a few people on a Zoom session know better than hundreds of institutions, hundreds of hospitals, facilities around the state, how to solve the problem of not enough nurses. The fatal conceit, Madam Speaker, the idea that one individual making edicts that chase nurses out of their profession will know better what facilities around the state need, what patients around the state need to have their medical needs met, will lead us to bad outcomes. Here we are, Madam Speaker, the fatal conceit that we know better than the hospitals, than the nurses themselves, than the people in the state, have led us to a situation of artificial scarcity and a problem in our emergency rooms and our care facilities. This is a bad bill, Madam Speaker, because it presumes to know better than the hospitals themselves and the nurses and their representatives themselves how to solve the problem. Vote this bill down, Madam Speaker. Vote no, and let's move to a system where the people on the front lines who know best how to solve these problems can make decisions in a bilateral way, negotiated at the most local level. Thank you.